Bloodborne pathogen. Safety, prevention, and protection in the workplace. Bloodborne pathogens are harmful microorganisms found in human blood that can cause serious diseases. These diseases include HIV, human immunodeficiency virus, hepatitis B, and hepatitis C. This makes understanding how they spread and how to protect yourself very important in workplaces where exposure risk exists, such as healthcare, emergency services, and laboratory settings. The primary way bloodborne pathogens are transmitted is through direct contact with blood or other potentially infectious materials. A common method of exposure is through needle stick injuries, where a needle or sharp object that has been contaminated with infected blood punctures the skin. Bloodborne pathogens can also spread when infected blood comes into contact with mucous membranes like the eyes, nose, or mouth. Open wounds are another point of entry for these pathogens. To reduce the risk of infection, the use of personal protective equipment, PPE, is essential. PPE acts as a barrier between you and potentially contaminated materials. The most common types of PPE include gloves, face shields, masks, and gowns. Gloves should always be worn when handling any materials that could be contaminated with blood or other potentially infectious materials. Masks and face shields provide protection for the eyes, nose, and mouth, and should be worn in situations where splashes or sprays of blood are possible. Gowns or aprons may be required when dealing with large amounts of blood or body fluids. One of the simplest and most effective ways to protect yourself from bloodborne pathogens is proper hand hygiene. After removing gloves or handling any potentially contaminated items, it is crucial to wash your hands thoroughly with soap and water. This removes any harmful microorganisms that might be on your hands. If soap and water are not available, using an alcohol-based hand sanitizer is a good alternative. Always remember to wash your hands before eating, drinking, or touching your face. The importance of this cannot be overstated, as it significantly reduces the chances of transferring pathogens to other areas of the body or the environment. In the event of an exposure, it is important to act quickly. If you experience a needle stick injury, or if blood or other body fluids splash onto your skin, eyes, or mouth, immediately wash the area with soap and water. If blood enters your eyes, use an eye wash station or rinse them under clean water for at least 15 minutes. Time is critical after an exposure, so you should seek medical attention right away. Reporting the exposure to your supervisor is also essential so they can ensure the appropriate follow-up care. Employers are legally required to offer vaccination against hepatitis B to workers who may be exposed to bloodborne pathogens. If you haven't been vaccinated yet, speak to your supervisor about getting the hepatitis B vaccine. The vaccine is highly effective in preventing the disease and is typically administered in a series of 3 shots over several months. Vaccination is a crucial step in preventing long-term complications from bloodborne diseases. It is also important to know how to properly dispose of contaminated items. Blood-soaked bandages, used gloves, and contaminated needles should not be thrown away in regular trash bins. These items must be disposed of in designated biohazard containers. These containers are specifically designed to safely contain hazardous waste and prevent accidental exposure. In addition to using PPE and disposing of hazardous materials properly, it's important to follow standard operating procedures, SOPs, for dealing with contaminated materials. SOPs outline step-by-step